Good afternoon from sunny Miami. This is Dr. John Bennett for InternetMedicine.com. Today we have the pleasure of having Imran Kahn, MD, a neurologist from California, a physician entrepreneur, as well as the webmaster of a huge website on autoimmune disease. And he's going to tell us about both the business and that website. And we're joined by a few distinguished panelists from all over the world. So we'll start with you, Fred. Could you please introduce yourself?
Hi guys, my name is Frederick. Live from Belgium. It's the middle of the night here, and I'm glad to be back on the panel. So enjoying the, looking forward for this hangout.
Welcome, Frederick. It's always good to have you. And Adriana?
Hello. How are you?
Okay, could you please introduce yourself, what you do and where you're at, etc.?
Yes, hello. My name is Adriana Vallejo. I'm a medical doctor and I'm working in clinical research here in Monterrey, Mexico.
You're welcome, Adriana. And by the way, she's at work on her iPhone. It's good to have her. Okay, Simon, welcome.
Hello, everyone. My name is Simon. I'm in Tokyo, Japan. I'm a developmental psychologist and a medical student. Thank you.
Our number two man, welcome, Simon. And Slaven, welcome. Good evening.
Hello everyone, good evening. My name is Slaven. I'm another European part of the panel, and it's also midnight here. I'm a medical student who is very interested in neurosurgery, and I'm happy to be here. Thank you.
Okay, not new surgery tonight, it's autoimmune and infusion therapy. Okay, welcome, Doc. Why don't we start? Why don't you start off by introducing yourself, where you trained, where you grew up, and how you end up in LA?
Yes, my name is Imran Khan, and I grew up in Pakistan. And in Pakistan, I wanted to become an engineer, ended up going to medical school because my father wanted me to become a doctor, and then I graduated from medical school and went for further training to London. I trained at Queen Square Neurology and started tilting my career towards neurology, and then did a residency in neurology in University of Arizona, and finally landed a fellowship at the National Institutes of Health, which I did in epilepsy. And at that time, the treatment of epilepsy was just plain surgery, and I was not too happy with it. But during my training, my wife got sick with a disease, Takayasu's disease, and the end result would be that they would have to do surgery and all these things. So I changed my career towards doing research on autoimmune disease, and this was purely internet-based research, as at that time the first internet had been established. So my research continued, and with my research and with the doctors, I'm happy to say that she did not do any surgery, and she is fully recovered from her Takayasu's disease. And I have come to see other patients, in early Takayasu's disease, who have again fully recovered, which I treated based upon the research. I have not published these things, but these things have already been published, various treatments of Takayasu's, and most of these studies were done in Japan. So the person in Japan is in the most advanced place, because I have learned most from the Japanese scientists.
That's interesting. That's very interesting. Doc, how'd you get into the Kaba fusion business?
Kaba fusion, as I changed my career and I was doing research, one of my brother-in-law was running a company in California. He's a neurologist too, and this was HealthNet, HMO. So I used to work with him in that HMO, and after he stepped down from the HMO, I went away from medical practice. Medical practice is very, very difficult. I absolutely devoted 24 hours a day to it, so I did not want to go back to medical practice, and I started working with a company called Crescent Healthcare. Crescent Healthcare was the first company made by a pharmacist called Suhail Masood, and this company used to give IVIG to patients. I really enjoyed this because they were dealing with all kind of autoimmune diseases, giving IVIG, and when we used to see no matter what type of autoimmune disease was, IVIG was given, the patient would improve. And in those days, in neuropathy, Dr. King Ingle was treating neuropathy, and later on this neuropathy was people started calling it CIDP, chronic inflammatory demyelinating polyneuropathy. The insurances wouldn't approve it, but fortunately now FDA studies have been done and IVIG is approved for CIDP and neuropathy.
Could you, before we go forward, Doc, could you explain what IVIG is, please?
IVIG is, as simple as it gets. When we are born, we drink the mother's milk, which is colostrum. That colostrum is full of antibodies to build our immune system, and those are IgG antibodies mainly. And IVIG is the same antibodies, but they are removed from plasma. So people go and donate their plasma, and antibodies are removed from that plasma, and from 20,000 patients. And when they are pooled together, the component is called intravenous immunoglobulin.
Okay. And do you want to go through the website of CabaFusion very briefly? Let me take it up here.
I must say CabaFusion is one of the great companies supplying IVIG. It's a one-stop shop for IVIG. You call CabaFusion, they will get the insurance authorization, they will write the letters of medical necessity, they will take care of your co-pays, and they will send IVIG to your home with a nurse. So this is just one-stop shop for everything related to IVIG. They carry all the brands, and I consider it the top company in the United States.
Do you work with that company?
I work as a medical liaison and in sales for this company. So I go around visiting mainly neurologists and telling them what conditions IVIG can be used in.
Well, there's an interference here for somebody. Okay, I guess there's some interference.
That's Vin.
Ben, was interference from you.
Sorry. Perhaps mute. You can mute him.
Okay. Okay. This IVIG, that's the main product of CabaFusion?
That's the main product. That's right.
Okay, and what kind of patients is CabaFusion aimed towards? It's more than autoimmune, right? It's AIDS patients also?
AIDS too, but somehow in the United States, FDA has not approved IVIG for AIDS patients.
Okay.
So it hasn't taken off in that arena, but it has taken off in the neuropathy area, CIDP, and 90% of the patients that we see are neuropathy or CIDP or multifocal motor neuropathy.
Okay.
Then the next are myasthenia gravis, and after that, stiff person syndrome. So these are the common things, and of course, immune deficiency. We see a lot of immune deficiency.
Okay. And okay, it's not indicated, not approved by the FDA for HIV.
HIV, if they have immune deficiency associated with the HIV, it is approved.
Okay.
Otherwise, for AIDS alone, it's not approved.
Okay. Okay. So, I don't know if the kids are in school, they're up to date on autoimmune disease. It's been a few years because, Doc, it's it's not a real common disease in regular practice. I didn't see many cases in the emergency room, but I'm sure, a specialist like you would probably saw a lot. What made you get into autoimmune disease from neurology? Is it because of your wife mainly having the Takayasu's disease?
Takayasu's, that's how I got into it. But nowadays, all the research that is coming up, like from Alzheimer's to autistic disorder to epilepsy to neuropathy, movement disorders, all are being considered the main cause is autoimmune. So even things as common as Parkinson, people are considering they are autoimmune. So most diseases that we think didn't have an origin or didn't know how they occurred are now being considered autoimmune. So this is a very rapidly growing field, and most of the patients that were misdiagnosed, like mislabeled, like fibromyalgia or chronic fatigue, really have autoimmune problems if they are looked into. They may have myasthenia gravis, CIDP, and they can be treated. So a lot of people are missing these patients and labeling them wrongly.
Right, right. Now, yeah, so you have a lot of anecdotal type of stories of that therapy working, but it's not evidence proven.
No, actually, FDA has approved a lot of these diagnoses, like CIDP is approved, myasthenia gravis is approved, stiff person has not been approved, but every insurance company will approve it.
Okay.
So we are getting reimbursed for it.
Okay.
So if you come down to chronic fatigue or fibromyalgia, there was a study done in UCLA, and they said the fibromyalgia was being misdiagnosed, but actually these patients had was CIDP. If you did nerve conduction studies, all of these patients ended up having neuropathy, and they were treated with IVIG. They got better, and that was Dr. Caro, the head of rheumatology in UCLA, who did the study.
Okay.
So if we go to the doctors and give them the study and handout and say, if you find CIDP in them, then refer them to us. And I have seen these patients who are walking with crutches now walking independently.
Really? What's the normal course of therapy, or every patient's different for IVIG?
I'm going to give you a very easy way how to do it. If there's a disease called Kawasaki's disease, which happens in kids.
Okay.
Kawasaki's, suddenly the child gets fever, rash, and cardiomyopathy. But if the child is treated with IVIG for 1 month, for the rest of his life, he will not have any problem. So the same thing goes for all the diseases. If you treat an autoimmune disease right at the onset for 1 month, for the rest of their life, they will be okay. But if you keep on waiting, let the autoimmune disease go on, the longer you wait, the less it will work.
Wow, that's interesting. Now the therapy, when the nurse comes to the house, typically how long does it last? Is it a 1, 2 hour, 3 hour?
If it's a child, it's going to be 1 or 2 hours. But if it's an adult person, it's going to be 3 to 5 hours.
Okay.
With an adult person, of course, the weight is more, the more medicine has to be infused.
Okay. Okay, like a drip. Okay. Okay, Simon and Slavin, and do you have any questions of the doc?
Hello, thank you very much, Dr. Kahn. I'm interested in your presentation. I'd like to know what advances regarding this came out of Japan. Since I'm in Japan, I'm interested to know what changes happened here.
The number one was Takayasu's disease. The Takayasu's disease was treated with medicine called doxycycline because the doctors believed there was a microorganism triggering the disease, and the patients got better. And there were 9 patients reported, all 9 got better. Then I tried this therapy in my wife, it worked. And then I went to Pakistan and tried this in new Takayasu's patients. I just had to give them doxycycline 1 month, and that Takayasu's, which was new onset, reversed.
Wow.
You must have felt like a messiah.
I mean, that was a study done in Japan, and there was another patient who I met who came from Japan. This was at a time, couple of years ago, when there was no treatment for fibromyalgia. And she said she went to Japan and she was treated with the doxycycline, and all the pains went away. And I went ahead and repeated this in Pakistan, and it was helping patients. So
I'm sorry, because you are a doctor yourself, you were able to do it and to convince other doctors to do it. But if you had not been a doctor, would it have been very difficult to start this therapy or to convince them?
Absolutely correct. Very, very difficult. And if you try to tell doctors this or bring that study out, it's very difficult to convince them. But nowadays, the research in autoimmune diseases has tilted that everybody is looking for an infectious organism or some protein which is causing them, triggering them. So people are looking for this, and a lot of research has come in. In nearly every disease, they have found something triggering that.
I see. Thank you very much.
Slavin, do you have any questions?
Well, yes, thank you. I actually have 2 kinds of questions because I'm interested in what you were talking about with Dr. Bennett. You were saying that how much is the incidence of such conditions, the autoimmune disease? I think of autoimmune disease today as a kind of a modern age disease, of this age disease, because I kind of saw that many young women especially have problems with diseases like the lupus erythematosus. And I'm also interested in your view about connections between autoimmune disease and neurology, about treatments. You mentioned myasthenia gravis and other conditions, and so I'm interested. How do you view this area as an expert in both autoimmune and neurology? Thank you.
Okay, very good question. Number one, as you are seeing this problem a lot in young women have the most common patients with autoimmune diseases. So autoimmune diseases in the United States have become nearly the #1 cause of disease unofficially. Officially, they consider it the #3. But if you see cardiomyopathy, rheumatology, neurology, all these arthritis, SLE, they are all autoimmune. So autoimmune is essentially the #1 cause of the disease worldwide. So whenever you see a young woman with problem, that's the first thing you should consider. And usually these patients come in saying they are fatigued, they have pain, they are tired. And you are very good, because most people consider that they are not having any problems, or they forget to do the CRP and they miss the diagnosis. So in neurology, most of these diseases like neuropathy or diabetic neuropathy, which are now considered CIDP, were not being treated in the past. Now they are treating these with IVIG, and if you treat them for 1 month, majority of the patients get better. They are doing very well.
Normally if you have a patient come in with the symptoms you described, as feeling tired, a young girl, autoimmune antibodies aren't in the normal workup, correct? It's basically CBC, P7, and I don't think most doctors would include that. Is that right?
That's right. Most doctors are not doing this, so it's time that we start doing the antibodies, and especially doing the IgG level and IgG classes.
What is what is the basic screening test you would definitely suggest you definitely should do to pick up a lupus or?
IgG level, immunoglobulin G level, and immunoglobulin subclasses.
Okay. Well, we're joined by a gentleman that likes immunology, Doc, so he came to the right spot. This is Rick Mose. Hi, Rick.
Moroz. It's Moroz. M-R-O-Z.
Moroz. Okay, I'm sorry. This is.
That's all right.
This is Dr. Kahn, and we're just talking about immunology right now and how a lot of cases slip through the cracks because most doctors, like me, don't really suspect it on people that come in with symptoms like feeling weak and tired. And why don't we do this, Doc? Let's go through your website here of your immunology, autoimmune. When did you start building this site? You actually built it yourself?
I built it myself, and this website is more aimed at countries where medicines are not available. In US you can get IVIG very easily, but if you go to other countries, IVIG may not be available, but it is becoming available all over the world. So this is built for those people. So if they can't get help, they can just read and help themselves easily.
Okay, I'm just going to show your website here, and maybe you can take us through it. Give us a little tour. And so you started this when, Doc? How long ago?
It was in 2000, year 2000 I started this. So it's slowly built up, and it was started mainly for patients with the neuropathy who had symptoms of neuropathy. At that time, neuropathy was not an approved diagnosis by the FDA, and then they came up with CIDP, and then we added CIDP to it, and now CIDP is an approved diagnosis.
Okay. You want to take us through the main part? Any spots we should go through? Diagnose. Okay, we just talked about the diagnosis.
Yes, yeah. In the diagnosis, I mainly put in that if people are coming in with complaints of fatigue, weakness, numbness, they should be worked up. People don't work up these patients. They usually end up telling them it's all in their mind. So if they are worked up immunologically, a lot of them may be immune deficient or have autoimmune diseases.
Okay. I'm just going to the treatment here, moving along. Guide to treatment.
In treatment, as I've been to different rheumatologists, celiac disease has become very common in general. And most rheumatologists are treating, the first time they see a autoimmune patient by giving them a celiac diet. So I recommend this, that the first time a patient gets diagnosed, they should be put on a gluten-free diet. And if they don't get better, then further you can treat them with IVIG or other immunosuppressants.
Okay. Okay, is steroids commonly used?
You know, steroids were being used a lot, and they are still being used, but their use is going down because of the side effects.
Right.
And the other reason is the insurance companies don't reimburse well. You know, the doctor is only paid $25 or the pharmacy is paid $25 for a steroid. So it's not cost effective for them.
Okay. Okay, the pathology. See, do you say much there?
In pathology, generally, if you do the pathology, you see inflammation and atrophy. And that is in all types of patients, you'll see inflammation and atrophy. And usually a triggering organism may be present, a virus may be present in these people depending upon the disease.
Mm-hmm.
Yeah, there seems to be there seems to be some new evidence that Zika virus is triggering in some cases the relationship with Guillain-Barré.
That's very good. You know, very good, and that's exactly viruses like Zika are responsible for these conditions.
Yeah, some of the enteroviruses have been linked to it as well.
Absolutely correct, and they've even been linked to multiple sclerosis.
Is this all new?
Actually, some of these viral links have gone back 40 years, but the problem is no one recognized it or bothered to look for an immunological diagnosis. So part of the problem is that it's been there, but no one really looked at the evidence.
Yeah, the doctor was talking about that before he came in, Rick, about most doctors don't suspect it, so they don't test for it. So, very good. Let me go back to your website here. Just give me a second to get it up. Well, that's what she said. All right. Okay. Okay.
Yeah, one of the projects I had my students do recently was, of course, some immunology case studies, and so we were looking at different disorders, including some immunologic disorders. So what we'll be doing is through Dr. Bennett's website, TV, Larkin TV, will be posting some of those done by the students.
Yeah, we're looking forward to that. Maybe we can include the doctor in those too.
Oh, certainly.
Let me. Okay, you don't see that? Am I sharing the screen correctly or not? No, I don't think I am.
Yes, you are. You are sharing. Yes.
Oh, okay, okay. Okay, Doc, you want to take us through? You mentioned fibromyalgia a few times. Is that considered an autoimmune disease?
You know, fibromyalgia was not considered autoimmune disease until the study was done at UCLA, where Dr. Caro said that actually fibromyalgia has been misdiagnosed. Most of these patients are CIDP patients. They have neuropathy. That's why they are complaining of pain, numbness, and fatigue. And once these patients were treated with IVIG by Dr. Caro, majority of them recovered. So they are saying most of fibromyalgia is being misdiagnosed. Actually, it's other diseases.
Yeah, I missed some of your earlier discussion about the treatment. What type of treatment are you looking at with this?
You know, in the Dr. Caro at UCLA treated those patients who had CIDP, were misdiagnosed as fibromyalgia with IVIG for 1 month. And
IVIG or what? What is that?
Intravenous immunoglobulin.
Well,
Okay.
yeah, we kind of talked going over that, but that is one of the main drugs that's used now that you advocate, correct, Dr. Kahn?
Correct, correct, and it's approved by FDA for IV or for CIDP.
Okay, and it's is it a pretty viscous solution, or is it just normally mixed into an IV solution, clear
Very
solution?
good question. It is a pretty viscous solution as it has a lot of protein, so that is the reason it has to be infused very slowly, or the patient may end up with thrombosis.
Okay. 25 cc's an hour or something like that?
That's even slower.
Even slower.
About that, 25 cc an hour will be okay.
Okay. Okay. Diet, anti-inflammatory. There's an anti-inflammatory diet that you recommend?
You know, the diet is the gluten-free diet. So for any problem, a patient should first start with a gluten-free diet, and if they don't get better, then they should make further changes, become a vegan. or take out milk from their diet, and depending upon what their problem is, one of these diets may help them.
Okay.
Doctor, I've been noticing, I finally got to the section where I could look up your IVIGs. What that looks like is something very similar to use for the Rh immune globulins. And
Correct.
It probably looks like it's a immunosuppressive mechanism more than anything else.
That is correct. IVIG kind of suppresses the autoimmune system.
Right, right. But any specificity on the immunoglobulin dosing, or where are you sourcing it from?
Most of the studies that have been done and show that 2 grams per kilogram once a month is effective dose.
Yeah. Well, what I'm wondering is this: where is it being sourced? Where are you getting it from? Because of course I come from a blood bank background, and one of the things that we look at is how many different products can you pull out of a unit of blood. I mean, literally, you could pull out the IV, the immunoglobulin, especially the IgG, fairly easily.
Yes, you're correct, and Red Cross was the first one to come out with IVIG from their blood products, and now it's being made through plasma donations. People get paid for plasma donation, about $40 to $50 a donation, and they take IVIG out from there.
Thank you. Can you hear me?
Yes, sir.
Okay, good. Okay. We're in Florida, South Florida right now, and we're having a terrible thunderstorm outside. So this thing is.
Well, thank you, Rick, for trying to cover me, but I just had the mute on. But
Okay.
Doc, what is burning feet? I see that's the next on your website.
Neuropathy patients will frequently have this syndrome called burning feet. They'll feel tingling, numbness, and burning in their feet. So people consider it all kind of other diseases, but if they end up going to a neurologist and a nerve conduction is done, burning feet is actually a neuropathy, and it's actually CIDP.
Okay.
And with IVIG, it reverses this condition.
Well, I'm afraid to ask about the next option, Bible healing.
Of course, a lot of people call me about this. Studies have been done on prayer, and any study which has been done on prayer, it shows that prayer works. So no, I don't know how it helps, but for some people who like prayers, I've just added a prayer section.
Okay, that's very good. A little spirituality never hurt anybody.
Yes.
Let's see, any questions from the panel?
I just had one question regarding why. I mean, if you start the IVIG within the first month, then it's effective, but then it's not working after a month. I'd like to just learn a little bit more about that. Would you still?
The quicker you give IVIG, the quicker you give the treatment, the faster it's going to work. So if you let it go on the disease a long time, so much damage is done that it's hard to recover that organ. So they have seen this in Alzheimer's. If they gave IVIG very early in Alzheimer's, a high dose, the patients recovered. But if they gave them a low dose and gave it to advanced patients, those patients did not recover.
I see.
This is another type of question, Doc. With genomics becoming more and more popular, how much a role are autoimmune diseases inherited or genetic? Are every one of the autoimmune different as far as being inherited from parent to child?
That is correct. The people have a tendency towards autoimmune diseases, and different people in the same family will develop different diseases depending upon the gene they inherited.
Okay.
Father may have diabetes and the daughter may have lupus.
So would you suggest a family doctor, if they find it in a family, they should suggest the other family members be tested?
Definitely.
Okay, well, that's how genomics will impact medical care, actually. to be on the hunt. And I'm sure the genomics is going to get better and better at identifying markers for certain diseases. So if you have something like lupus, the offspring may inherit not lupus but another autoimmune disease.
Lupus is one disease which will attack every single organ in the body.
Okay.
So lupus is not going to spare any organ in the body. So it's going to, from nerve problems to heart problems to brain problems, skin, it's going to affect everything. So again, in lupus, when IVIG is used, you see not one organ, but all organs respond. They improve.
No, what I meant to say, Doc, is that if you have some, say, a woman that has lupus, her offspring, do they necessarily get lupus or another autoimmune disease?
They will get another autoimmune disease.
Another one. So it's kind of tricky.
Very tricky.
Yeah. Okay, that's interesting. That's interesting. Okay.
You know, there is another disease called multifocal motor neuropathy. Multifocal neuropathy doesn't cause any numbness, burning, or pain. It just causes weakness, and it's usually misdiagnosed as ALS or Lou Gehrig's disease. And again, these patients, once they were given IVIG, if they were misdiagnosed as ALS, they improved. So,
okay. Go ahead.
Multifocal motor neuropathy is a very important disease which is responding to IVIG, and most of these patients are being misdiagnosed as ALS or Lou Gehrig's disease.
Oh, interesting. Now you have a menu option that says hepatitis. Could you talk a little bit about that, please?
You know, hepatitis is also autoimmune, and hepatitis is now unfortunately more common in the developing countries. If you go to India, Pakistan, hepatitis C is present all over the population, and they are trying all kind of different immunosuppressants to treat it.
Mm-hmm.
So in early hepatitis, IVIG has been used and found effective.
Okay. So it's not the infectious or the type or from the needle. It's another type. So if you have someone with hepatitis, you should rule out the Hep A and Hep B, correct?
Correct. But the inflammation in the liver that is taking place is usually autoimmune related.
Okay, that's interesting.
I'd say you're better off to rule out B and C. Hep A is going to present a bit differently, and is really, is waterborne, foodborne. I mean, digestive tract. So I would say B and C are more likely to need to be ruled out.
Mm-hmm. Okay. See what else we got here on the menu. Celiac disease. Could you comment on that, Doc?
You know, celiac. I was in Saudi Arabia, and over there, the vast majority of the population had celiac disease. I mean, the reason was morning, afternoon, and night, they all had bread. Bread was the main thing in their diet. This is something you don't see in China, where there is a rice-eating population. So Chinese take extra gluten and they don't get celiac, while the Arab countries are getting celiac quite a lot, and it's very high proportions. So at least about 14% of the population ends up with celiac over there. And you're seeing, I saw children in Pakistan who were deaf, blind, small in stature, and neuropathy, all kind of problems due to celiac disease. So in developing countries, it's a big problem, and they have these stools which are like oily stools. And doctors do not recognize this, but now more and more doctors are being treated in celiac, and they are advising them to go on a gluten-free diet and only use white bread or avoid bread altogether.
Now, osteoporosis you have on the menu. Can you comment on that?
You know, osteoporosis is, again, it's a lack of it's mainly osteoporosis is being triggered by celiac. So if you take a celiac patient, they will have low B12, low vitamin D, low calcium, because people are unable to absorb all these nutrients, and they develop all kind of atrophic problems even in the bones.
Mm-hmm.
So, these people who are getting osteoporosis need to go on a celiac diet.
Mm-hmm. Okay, very good. Adriana, do you have any questions? Are you still there, Adriana? She is nice enough to join us from work. on her smartphone. But Adriana, do you have any questions of Dr. Kahn? You're muted.
I'm sorry. Can you hear me?
Yes, we can hear you.
Sorry, I had muted my phone.
She's at work.
Yes, I was wondering about the relationship between the hepatitis, because you were talking about the most common hepatitis is C in India and Pakistan.
Yes.
That's something different from here in Latin America. We normally have more B hepatitis, so that's interesting. How do you see that difference between both populations?
You know, in Pakistan and India, the people are not being taught hygienic conditions, very, very unhygienic conditions. You know, a person will not wash their hands, and they will be cooking with the same hand and serving food with the same hand. So hygiene is a big issue over there.
Okay.
Yes.
Yeah.
Yes, it's that's important.
One question on my end: does the tendency towards celiac disease, is there any relationship to osteoporosis or secondary to osteoporosis because of poor absorption of calcium, whatever?
Yes, you know, if you see any celiac patient, not only calcium, magnesium, and vitamin D and B12 all will be low. So that is one of the main reasons that, you know, osteoporosis is going on. So once you go on a celiac-free diet, your stomach improves and absorption improves. These people do get better.
Yeah, that could help explain the burning feet syndrome because of the B12 deficiency.
Correct, correct.
No, yeah. How would you distinguish a neuropathy? Well, this is probably getting off the topic. Neuropathy. Is there neuropathy of diabetics different from burning feet? Is it?
You know, in general, all the neuropathies are demyelinating. That means the myelin is affected. So the neuropathy could be B12 deficiency or autoimmune, but the attack, that the real pathology is myelin. Myelin is being attacked.
Okay.
Right.
So somehow anything will trigger an attack on the myelin.
Yeah.
Okay.
But then especially with the B12 intrinsic factor, immunity, autoimmunity to intrinsic factor can affect the uptake of B12.
That is correct, and if B12 is corrected, and most experts recommend that B12 should be given intramuscularly, these patients do improve with B12.
Yeah, well, in the U.S. it's seen primarily in elderly patients, over, you know, usually over to age 60 to 70, and especially women.
Absolutely correct, and this was very common. You know, the B12 injection was very common in the US about 60 to 70 years ago, until the insurance companies decided they will not reimburse the doctors unless there was proven deficiency, which was very difficult to prove because the level is artificially set low, so you cannot prove the deficiency.
Well, again, with the relationship of B12 and cardiovascular disease, I have a routine screening of B12 because of the relationship with type 2 diabetes and cardiovascular disease. So that's another link, sort of bringing together the concept of the autoimmune syndrome that I think you're discussing.
Yeah, that's very, very good to tell me this. So do you see that if you give B12, the cardiac function improves?
Well, that seems to be the strong evidence that atherosclerosis and other diseases associated with CVA are reduced by the use of vitamin B12, high doses of vitamin B12 and D3, vitamin D3. So a lot of patients who are taking, especially simvastatin and other statin drugs, as well as treatment for type 2 diabetes, like myself, end up taking vitamin D, B12, and folate.
That's interesting. Okay, any more comments or questions, Simon, Slavin, or Adriana?
I have one very short question. Just to ask you, what is the prognosis of the systemic lupus erythematosus? Because if you treat it with these new drugs that you were talking about, so can you just comment on how does this disease, what is the flow of this disease? Because it seems that it is uncurable today. Thank you.
You know, if you treat these patients early on with IVIG or even in a couple of years later, the progression will stop and will be retarded. IVIG has helped a lot of patients. So now, you know, the time has come that we can reverse these diseases currently.
Yeah, or catch them early. It seems that what I get from your talk today, Doc, is that when you have someone be aggressive in trying to screen, especially people that have relatives with it. So you can start early, like you said, so you can start the therapy early, because I didn't realize that the earlier you start the therapy, the more effective it's going to be in the long-term prognosis.
And as you heard, you know, the vitamin D3 is very important, and B12 is very important. And now in Europe, vitamin K2 has come out, that K2 is very important, and K2 is what is found in the green vegetables.
Right.
Okay. Okay,
Listen,
very good.
and one more short question is about the multiple sclerosis as a disease. Can you comment on this disease? What is your current knowledge and possible treatments? I saw that there is many things going on in this area. It is an area of research. So.
You know, number one, multiple sclerosis occurs only in the northern or southern areas where sunshine is less. And those areas are typically where vitamin D deficiency is prevalent, especially in these black populations from Africa who have moved into these white areas, you know, where sun times are very, very low. So these people, the black people, will develop multiple sclerosis very, very quickly in those areas. So by giving vitamin D3, I have talked to many doctors and they said the incidence of MS has gone down.
Very
so
good.
Giving vitamins are very important, and IVIG is very effective in MS, but MS has now so many other treatments available that we don't push IVIG a lot in multiple sclerosis.
Yes, I understand. Very interesting, and thank you for these remarks. Thank you.
Okay, Dr. Kahn, I appreciate you coming out tonight and spending the time to help educate us on the IVIG therapy, as well as your huge website on autoimmune disease. And thanks for all the panelists to come in. And Rick, you're going to be punished for being late.
Oh well, hey, you know, it's storming here. They're predicting maybe golf ball sized hail. You know, if you really want proof,
Rick,
I'll stick
I live in Florida. There's no rain here. Come on. Okay. Okay. Thank you very much, Dr. Kahn. We'll hang around. We'll end the broadcast now and we'll talk. Okay. Thank you.